Joining us now on the program are a couple of individuals from Metro EHS. Anthony Dabish and Porsha Covington join us now to talk about a number of different pediatric therapy services that they provide at their business. Thank you both for being with us today.
Hi, thanks for having us.
Glad to have you both on. Anthony, let's begin with you. Just tell us a little bit about Metro EHS and some of the different forms of pediatric therapy that your business provides.
Sure. We offer pediatric therapy such as ABA, which is applied behavioral analysis. We offer speech, occupational therapy, physical therapy, feeding and swallowing, as well as counseling for children across the Metro Detroit area. We have 14 locations across Metro Detroit, and we currently just opened a brand new location on Orchard Lake in West Bloomfield.
And sometimes these are therapies that are necessary for major complications or for developmental issues that can arise at early ages. And certainly the earlier you address these issues, we've heard on so many different fronts, the better those results tend to be. And so, Porsha, tell us about the typical clientele that usually is coming through Metro EHS to take on these services, because you do provide a wide range, but they are pediatric services and everything's always going to be a little bit different when it involves our kids.
So we have anywhere from infants around 3 months up to around the age of 15. We also have feeding and swallowing therapy for those little ones that are just born and having a few problems latching on to. We offer the best type of therapy. It's very intensive for our children's needs because there's speech, there's occupational therapy, there's physical therapy, and applied behavioral analysis all within the same building. So all of our staff tend to work together to make sure that the child is fully developed to the best of their ability within our care.
And back to you, Anthony, as you mentioned, and Porsha mentioned some of those, swallowing and feeding therapies too, especially for those younger kids and those infants that may be having trouble with some of these, what we consider to be basic behaviors and basic acts that we tend to take for granted each and every day. How common is it for kids of those ages to have some of these problems and need to seek some of these therapies?
There's a wide range. It's actually a lot more common than people think. A lot of kids are picky eaters. For example, we had a patient that only ate chicken nuggets and that was it. As well as there's more in-depth problems that kids have with feeding and swallowing, which we tend to find the resolution for any problem that comes to our table.
I would imagine to provide these therapies to kids, especially at ages of a lot of plasticity or a greater need for development and some of these more, so to speak, basics of human life and human behaviors each and every day, that makes these a lot more intricate than it would maybe be if you were providing some of these sorts of therapies to an adult. So how does that change the approach, or how does that maybe modify the approach, Porsha, as you're beginning to treat some of these pediatric patients and hopefully have great results ahead for them so they can lead a much more normal lives like you and I do?
The one thing that we have to keep in mind is that it takes a lot of patience to deal with these clients. It takes a lot of communication and to know that the answer is not just going to happen the next day. It will take a lot of understanding for the parents to work on all efforts at home, to see the progress. We may have children with us for a couple months, and sometimes it may take a couple years, but we just want to make sure that we're touching every aspect that the child needs within the time frame that we actually have them. So it's a progressive journey to get through therapy.
You can find more information on a number of their services, and they're quite extensive, from, as I mentioned, ABA and speech and occupational therapy, all the way to special education staffing and homeschool services as well. Find more information on the website, metroehs.com, with locations all across southeastern Michigan. You can call them as well at 313-278-4601, 313-278-4601 for more information. And then Anthony, there's a number of different therapies that you are providing through Metro EHS at your locations all across southeastern Michigan. And given that there is such a wide range, how do you keep up with that in terms of staffing and in terms of making sure that you have the right experts in the right locations for these different specialties, considering that they are so wide ranging?
We're constantly hiring people. There is no wait list, which it makes us set up differently from other therapy centers. We just have a wide range of, we do hiring events. So if anyone out there is interested in coming to join our team, please give us a call as well. But it's a constant effort to try to get people to join us as therapists and stuff like that. A lot of our pretty much all of our therapists are board certified and stuff like that. So we're constantly going to colleges and doing hiring events, and it's just so on and so on.
Porsha, we've seen over the last few years, especially due to the pandemic, that telehealth and teletherapy has become much more of the norm than it was in the past. And it's one of the many services that are provided by Metro EHS, not just to individual patients, but also the schools. So tell us about your teletherapy programs and how that benefits both these individual patients and families, but also even some of our schools that may be in need of some of this help.
It's an awesome service that we offer, the teletherapy. My son actually receives speech therapy via virtual meetings with his speech pathologist. And the platform that we have is engineered for pediatric ages. It's not very hard. He's 5 and he's able to maneuver through the website pretty easily. The staff are able to see everything that the child does on the virtual platform. So it's pretty amazing to see therapy happening virtually. We offer dietitian services virtually. Our speech pathologists and occupational therapists that are in the schools are able to do virtual meetings with their clients as well. So it's pretty amazing to see the virtual opportunities that are out there for our children.
More information can be found on their website, metroehs.com. That is metroehs.com for more information. And Anthony, for families that may be in need of some of these different therapies for their kids, we hear so much. We talked recently with an expert in autism spectrum disorder and and treatments for those that are on the autism spectrum, and she had mentioned that the earlier you get some of these treatments going, the better results you typically have, especially in younger patients, in terms of what their outcomes are from the results of these different therapies. So what's Metro EHS's suggestion on, because there's so many different numbers of these therapies that are available, on just how effective they are, especially for these pediatric patients, if they're getting in there earlier and if these are detected earlier on, to have as best of an outcome as possible?
The best outcome, or the first thing you can do, is actually go get a screening. You can go to your pediatrician. They can refer you to us, or we do screenings all the time at our centers. That would be if you detect anything unusual, which Porsha can probably explain that better than I can. But the first step is actually getting a screening. It's not an evaluation, but it's a step to see if your child has any issues, not just autism, but in speech, physical therapy, stuff like that, or occupational therapy. It helps get their motor skills going at an early age, and it's easier for them to it gets them used to working with someone else other than their mother or father. And that's another issue. What's good about our company is that we actually educate the parents on on what the problem is and what we do, so they can actually do that at home as well.
Yeah.
So the first step would be actually doing a screening.
Yeah, and if I might jump in, as far as autism goes, there's a questionnaire that are typically given by your pediatrician for your child, just to see where they are as far as their developmental milestones. And sometimes that questionnaire by your pediatrician can show signs of potential autism. And one of the best benefits of catching it early is that the child is not yet enrolled in school, so there's more time in the day to receive more therapeutic care.
And Porsha, just a few more minutes here, a couple more minutes before we need to say goodbye. You are a parent that, and you mentioned that you have had your child receive speech therapy too. So from a parent's perspective, what advice do you have for parents that may be seeking some of these services to, provide the best support that they can for their child, but also to ensure that they're getting the right therapies at the right time for their kids to have as great of an outcome as they can for their children?
So my child received speech therapy as well as occupational therapy with Metro EHS, and he is now enrolled in school full time. And I want to say the best thing about Metro EHS is, although he's not currently receiving occupational therapy, the therapist is willing to reach out to his school and open those lines of communication to see how he has developed thus far. It's amazing to see how far our staff are willing to go to make sure that the child is overall well taken care of, whether it's in school or in family life, as well as their own social and emotional needs.
You can find more information on Metro EHS and all of their services, as well as their various locations across southeastern Michigan, and teletherapy options as well, on their website, metroehs.com, or give them a call for more information and consultation, 313-278-4601. Anthony, Porsha, thank you so much for joining us today.
Thank
Thanks
you.
for having us.
Thank you.